According to the Arizona Grantmakers Forum, American volunteers evolved a revolutionary understanding of social responsibility in the course of building their own nation on values, including volunteerism. Americans continue to be groundbreakers in the area of giving in the 21st century, with numbers of charitable organizations pushing the 1 million mark, generating trillions of dollars. With over 100,000 charitable foundations and with almost 90% of adults volunteering their time. With a sense of social responsibility extended across national boundaries, private charitable organizations are able to make great breakthroughs in bringing aid to the third world. I interviewed a leader among volunteers, Mr. Knox Singleton, regarding his efforts to bring medical care overseas with the Community Coalition for Haiti. Today's interview was filmed prior to the 7.0 magnitude earthquake which devastated Haiti on January 14th. Do you have any personal philosophies on giving and kindness?
My philosophy about giving sort of boils down to the more that you give, the more that you actually get. I think it's one of those great counterintuitive truths that is rooted in my faith that giving is really a key to happiness.
How did you first become interested in Haiti? How do you help to bring about changes there?
My introduction to Haiti started in the early 1990s. There had been a group of physicians within ANOVA who had been traveling to this rural town in Haiti to help serve patients in a hospital that had been started there by a Haitian physician. They had traveled to Haiti for a number of years, and each year they would try to enlist me to go along, and every year I would say, you know, I'm not a physician, I'm not a nurse, I really don't have any of the clinical skills that would be useful there. I didn't think that really I could have much utility or be of value to the team. Finally, one year I broke down and said, if you want me to go, I will go, and I'm not sure what I'm going to do, but I will help wherever I can. And so that led to my first visit to Pignon, Haiti, the small town in the northeastern part of the country. And I've pretty much been going back between 1 and 3 or 4 times every year since.
What kinds of conditions in Haiti make a project like this one possible? Do you see conditions for this kind of philanthropic assistance in other third world countries? What about China?
Haiti is so different from the world that I interact with on a daily basis. It's practically impossible to adequately describe the difference. Haiti is the poorest country in the Eastern Hemisphere. It's the poorest country in the Americas. The average family in Haiti lives on between $2 and $3 a day. It's only about 200 miles from the United States coastline, and yet it's absolutely a world away. The areas we go to, as many as 30 to 40% of the children don't attend school. There's about a 50+% unemployment rate among adults. It's just a very desperately poor part of the world.
Is there enough support to keep the project going? Where can our audience go to find out more about the Community Coalition for Haiti?
The Community Coalition for Haiti can be accessed very easily if you go to cchaiti.org on the World Wide Web. You'll find our website. It'll tell you all about the various programs that CCH sponsors. It'll tell you about how you can support the program by making a gift. It will tell you if you're interested in possibly going to be a volunteer on a short-term basis in Pinon. We work in schools, we work in the community, churches and hospitals. You don't have to be a physician, you don't have to be a nurse, you don't have to be a school teacher. I learned that anybody can really make a major contribution through serving others through CCH.
What have you learned in the process of your medical relief work in Haiti that has reflected back on your work here as a leader at Innova Health Systems?
I would say working in Haiti has really brought two very important principles into reality and clear focus for me. That's really helped me as I do my work here at Innova Health System. One is that you often get discouraged when you look around at the obstacles you face, and maybe you don't have as many resources as you'd like to have, or you have challenges you have to overcome. Well, when you go to Haiti, you see folks who really don't have any resources and who have some incredible challenges. And one of the things it does is it really makes you appreciate how relatively achievable the challenges that you face in life are. The second thing that I get when I go to Haiti is a rejuvenation and you regain energy because the process of helping others really fills you with a sense of accomplishment and purpose. And I argue that I can be away for a week, and even if I've done very tiring, heavy physical kind of work, I come back with far more energy and far more enthusiasm than I would ever have had I never gone away. So you come back with a fresh perspective and a fresh sense of wind underneath your wings. It's a wonderful combination.
Do you have any advice for philanthropists and volunteers who want to bridge cultures?
I think that individuals whose goal through their giving or through their service to make a difference would be well served to look very hard at Haiti. For two reasons. One is that even relatively small gifts, monetarily or in terms of time, in Haiti there is such a desperate need that that even small contributions produce great results. The second is that Haiti is a country that embraces people of other cultures and other nationalities and other backgrounds very openly and very warmly. It's a welcoming people. They, if you don't look like them, if you don't speak necessarily their language, they look past all that and they really look at your humanity. And it's a place where I find you can bond and connect at a very human level very quickly. And in my experience, that enables you to have impact very quickly.
Something we may hear too often is the argument for keeping aid domestic. Please share your thoughts on reaching across national boundaries.
Haiti is one of those, I think, great examples of if you don't help the world catch up with us in this country, the world's problems will inevitably come to our shores. In the case of Haiti, you may remember that there have been a number of instances where hundreds of people, when the famine gets the worst in Haiti or economic or security conditions are the worst, the Haitians often answer to that is to climb, the poorest of the poor, climb in these rickety boats and they head for the United States shores. And they end up as penniless, destitute immigrants who have no other alternative but to become really wards of our country. If we don't go to Haiti, if we don't, in countries like Haiti, and help them to help themselves where they live, those problems, whether it's in the